fibroma, and hyperplastic scar. And all of these alternate names are pointing to the fact that a fibroma is caused by chronic trauma or irritation. So as far as connective tissue tumors are concerned, this one's very benign and actually pretty common. And it's specifically fibrous hyperplasia of the oral mucosa, in this case, the buccal mucosa, it looks like. Gingival hyperplasia is, if I could, I would put this in bright letters, neon, bolded, underlined, because this is tested in every exam I can possibly think of. This is one of the most commonly tested things out there. So gingival hyperplasia, also sometimes called gingival enlargement, is referring to literally the enlargement of the gingiva. And this is a side effect to the medications I have listed here. So calcium channel blockers, it's a side effect of those sometimes. Sometimes a side effect of Dilantin, also called phenytoin, which is an anticonvulsant. Sometimes a side effect of cyclosporin, which is an immunosuppressant drug. How I remember these are, I remember CDC, and the Centers for Disease Control and Prevention, or the CDC, is concerned about gingival hyperplasia. And then I remember calcium channel blocker, Dilantin, and cyclosporin. And of course, calcium channel blockers. If someday I talk about pharm in some videos, if you guys want that, calcium channel blockers include verapamil, nifedipine, and amlodipine, and a whole bunch of other ones. So that's super, super important to remember this stuff. And treatment for gingival hyperplasia would be, if it's serious like this, a gingivectomy, and possibly considering discontinuing that drug if possible. But sometimes it's hard to come off of a drug like this. It could be dependent, a patient could be dependent on taking one of these drugs, so it can be difficult to find an alternative. Denture-induced fibrous hyperplasia refers to two main denture lesions that are caused by a poorly fitting denture. The first is epilis fissuratum, which occurs at the base of the vestibule. So if you have like an overextended flange of a denture that's constantly bothering and irritating this part of the mucosa, the body can form sort of a callousy, fibrous mass there. And also, a poorly cleaned denture, or one that's also poorly fitting, can cause papillary hyperplasia, which is the same kind of deal. It looks a whole lot different because it occurs on the palate instead of the vestibule. If we're thinking in terms of a triad of denture lesions, I'd also include angular cheilitis, which we talked about before when we talked about candidiasis. And that's something that occurs in the corner of the mouth and can be linked to a denture that, again, is fitting poorly, and sort of the corners of the mouth are folding in on each other, and that's where fungus and other infections are taking place. So those three, you can kind of group together, these two plus angular cheilitis, as being denture associated. But since we're talking about connective tissue tumors, I only have these two listed. Next, we have traumatic neuroma. And this is an entangled submucosal mass of neural tissue, and a scar has formed. And it's caused by injury, but instead of like the fibroma, now we're adding on the component that it's injury to a nerve. And this is most common at the mental foramen. So the picture here, you can see we're kind of by canine premolar, second premolar area, and that's where we find the mental foramen. So that's what's going on there. And again, I have another syndrome, and I like to list them out like a math equation because it's a sum of a certain amount of conditions that must be met to make it a syndrome. And here we have multiple of these neuromas, plus medullary thyroid cancer, plus pheochromocytoma of the adrenal gland. And these three things constitute multiple endocrine neoplasia, sometimes called MEN for short. 2B is the form of it. So endocrine is, talking about the thyroid component and the adrenal component, and neoplasia, of course, referring to this abnormal growth with the neuroma. And one way to think about it is that men is short for mental, and mental foramen is most often associated with this traumatic neuroma lesion. Next, we have pyogenic granuloma. This is another pretty common one, and it's the hyperplasia of capillaries. So it helps in the clinical presentation making sense of it because it's this usually bright, very vivid